All right, future nurses, we got to talk about triage, right? It's something you're going to see a ton of in your careers.
Absolutely.
But we're not talking about your everyday run-of-the-mill ER triage today. We're going
Oh.
deep, deep, deep into disaster triage.
hmm
And to guide us, we've got this awesome training module specifically designed for nursing students.
Love it. You know, because while you're all learning to be these incredible caregivers in a normal hospital, you also got to be ready for those, whoa, what just happened moments.
Right. Like what happens when it all hits the fan?
Yeah, those mass casualty events, where everything's different.
Everything changes, yeah. So let's set the scene here. Regular ER, you're thinking about one patient at a time, chest pain, got to be seen before the sprained ankle, right?
For sure.
You're working with this idea that, okay, resources might be stretched thin sometimes, but they're there. Everyone's going to get treated eventually.
Exactly. But in a disaster, all those rules out the window. Imagine a massive earthquake, right? Or a crazy highway pileup. Suddenly, boom, tons of people need care, urgent care, and well, there might not be enough doctors, nurses, beds, even basic supplies to go around.
That's where this module really grabs you. It's like, whoa, disaster triage. It's not about treating everyone the same. It's about saving as many lives as possible.
I think that's one of the hardest things for nursing students to wrap their heads around. It's no longer just this patient in front of me. It becomes, thinking about the whole population.
It's a totally different way to think about it, yeah.
You have to shift gears and think, how do we save the most lives? Even if it means some tough calls.
And that's where the color-coded triage system comes in, right?
Yeah.
This module makes it super clear. It's not just some theory you learn about. It's a tool you got to know.
Like inside and out.
Like could save lives knowing it kind of tool.
Exactly. It's this system of flags, a quick visual shorthand to help medical teams make fast decisions under crazy pressure.
Makes sense.
In a disaster zone, every second counts. So this system helps get care where it'll have the biggest impact,
Okay, so walk us through it. You roll up on a patient, blood spurting everywhere. What color are we talking?
Ooh, that's a classic red tag situation. Immediate action, like right now.
Got it. Red equals drop everything. This is top priority.
This module makes it so clear. Red tag patients, they have life-threatening injuries, like massive bleeding, airways blocked, maybe they're showing signs of shock.
Oh, wow.
They need you right then and there, or their chance. Well, they go way down.
Okay, Red, I got it. What about someone with, let's say, a broken leg? They're conscious, breathing fine, bleeding's under control.
Okay, that sounds more like a yellow tag. Delayed.
So it's still serious.
They've got serious injuries, definitely, but they're not, right on the edge of death.
Right.
Think fractures, maybe some burns, abdominal injuries, but they're stable. They'll need treatment, of course, but they can wait a bit while those red tags are being stabilized.
Okay, so we've got our hierarchy here. Red is drop everything. Yellow is serious but stable. Where does green fit in?
Ah, green. Green is for the walking wounded. They've got minor injuries, cuts, sprains, things that can totally wait or maybe even be dealt with using some basic first aid.
I see.
The module actually points out that these green tag patients, they can sometimes even help out, comforting others, applying bandages, maybe directing people.
Oh, wow.
Every little bit helps in a disaster.
Absolutely. And then, well, there's a category nobody really wants to talk about, but
Yeah.
we got black tags.
Yeah, this one's the toughest for sure. Black tags are for patients who are either, deceased or their injuries are so severe their chances of making it are incredibly low.
Even with care.
Even with immediate care.
This module gives some pretty intense examples.
It does. Think massive head trauma, like most of their bodies burned, or complete organ system failure. It's the hard truth about disaster triage. Sometimes, no matter how much you want to, you just don't have the resources to save everyone.
It's not giving up on them. It's recognizing the situation and, like you said, focusing where you'll have the most impact.
Exactly. And even experienced healthcare providers, they struggle with this stuff.
Yeah.
The module makes that clear. It's not easy.
It's a huge reminder that disaster response, it's a total team effort.
Yeah.
Nobody expects you, especially as a nursing student, to have all the answers in the heat of the moment.
Right, right. And remember, this color system, it's not set in stone. A patient's condition can change so fast in a disaster, so you got to keep reassessing. Someone who starts as a yellow tag, their condition could go downhill. They might need to be bumped up to red.
So it's always changing.
It's a fluid situation, yeah. And that's exactly why, this kind of training is so, so important for nursing students. It's understanding that in a disaster, Decisions, well, they're made based on what's best for the most people, the biggest impact, a huge, huge shift in how you think.
And this module, it doesn't shy away from the tough stuff.
Yeah.
Like there's a part where it uses the term withholding treatment, which, I mean, that sounds so harsh. But I guess in these extreme cases, it's something you might actually face.
It's a reality, yeah, and it goes against, well, pretty much everything you're learning about patient care in a normal setting. It can be just a huge weight on anyone, emotionally, let alone a nursing student who's just starting out.
So how do you, as a future nurse, how do you even begin to prepare for that? To process those emotions and make those really, really difficult decisions in the middle of all that chaos?
Well, I think it starts with understanding the ethics behind disaster triage.
Okay.
The module does a good job laying out the framework, the reasoning behind these choices. And it's important to remember it's not about, playing God or anything like that. It's about a system that helps make sure care is given in the most just and fair way possible, given the circumstances, obviously.
Okay, break that down for us. What are those core principles, those guidelines?
All right, so the first one, the big one, is fairness. You're trying to use the limited resources, right? But in a way that benefits as many people as possible. It's not about who you know, your social status, none of that. It's about giving everyone the same chance at survival based on their medical needs right then and there.
So in a disaster, like a CEO and a homeless person, they'd be triaged the same way, based on how bad their injuries are, not their background.
Exactly. Then you have equity, which is recognizing that some folks might need more support to actually have a fair chance. Like the module gives this example of someone with a disability. They might need different resources, different things considered during triage, so they're not at a disadvantage.
So it's about making the playing field as level as you can, considering it's a disaster.
Yeah.
But still, you might have to make really hard choices.
That's true. And that's where the greatest good for the greatest number comes in. And this is where it gets super tough. Because sometimes it means decisions have to benefit the majority, even if some people, well, they might not get the care they would normally.
Like we talked about, someone who has a really low chance of survival, even with immediate care, they might get a black tag. And their care, it might be delayed so you can prioritize those who have a better chance.
Right. It's a tough decision, and the module, it acknowledges that. But in a disaster, when resources are stretched so thin, you have to maximize them, make sure they're saving the most lives.
I can see how this, just a whole thing, could be so stressful for healthcare providers.
It absolutely is, yeah. And the module talks about that. It's not about, becoming numb to the suffering you see. It's about finding ways to handle it, the immense pressure, and just making the best possible decisions in what are, honestly, often impossible circumstances.
This module actually offers some steps, some things nursing students can do to get ready for these ethical challenges, right?
Yeah. It does, yeah. The first thing, the most important thing, is communication. Open and honest communication with your team during a disaster. Don't be afraid to talk about what's bothering you. Ask for support if you're struggling with a decision. You're human. Nobody expects you to have all the answers, especially in these situations.
So a good team, a supportive team, that makes all the difference.
Huge difference. The other thing the module really encourages is to seek out extra training, more education specifically on disaster nursing and the ethical stuff that comes with it.
Makes sense.
The more you know, the more you've prepared yourself, the better you'll be at handling the tough calls that'll come up. It's inevitable.
So be proactive, build that knowledge, those coping skills now.
Yeah.
So when it happens, you're not totally blindsided.
Exactly. And for all you future nurses listening, remember this. You're entering a profession, well, it takes incredible strength, compassion, and resilience. Disaster triage is just one example of the tough choices you'll face.
But the good news is, knowing the principles, preparing yourselves, mentally and emotionally now, you'll be able to face those challenges with integrity and really make a difference for the people you're caring for.
It's also important to remember that even though disaster triage is about, saving the most people, treating every patient with respect and dignity, it's still so important.
Right.
Even if you can't give them life-saving care at that moment, comforting them, just supporting them, it can make a real difference.
Yeah, it's a good reminder that every life is valuable, even in the middle of all that chaos. Now, before we wrap up this episode, let's talk about how these principles, fairness, equity, maximizing benefit, how those go beyond just mass casualty events.
That's a great point. These principles, they're relevant in all sorts of healthcare decisions, even on a smaller scale. Think about organ transplantation, for instance.
Oh, wow. Yeah.
Way more people need organs than there are donors. So how do you choose who gets that life-saving transplant?
Or what about the debates about really expensive medications? Who gets priority when there's not enough to go around?
Those are tough questions. Healthcare systems are dealing with them all the time. And even though this module focuses on disaster triage, the principles we've talked about, they can help guide those decisions too.
It's a really interesting connection. I bet that'll resonate with our nursing student listeners. They're going into a field where these ethical questions, they're just everywhere.
Absolutely. And by thinking critically about them now, well, they'll be more prepared to deal with them throughout their careers.
And we're back, wrapping up our deep dive into disaster triage, especially for all you amazing nursing students out there.
We've covered some, well, intense stuff in this episode, from that color-coded system to the really tough decisions that come up in those high-pressure moments.
Yeah, not exactly light topics. But this module, it really makes you realize how important it is to have these conversations early on in your nursing education.
Absolutely. The more you understand about disaster response, how it really works, the more prepared you'll be when it happens, because it will at some point.
This training module, it hammers home the point that disaster triage, it's not just about memorizing colors. It's a whole new way of thinking, especially for a healthcare provider.
Totally. It's that shift, from thinking about just the one patient in front of you to thinking about the entire population.
Right.
And remembering that every decision, it's got to be guided by fairness, equity, and doing the most good for the most people.
It's a huge change, especially when you're still learning the ropes of nursing, all the basics.
It's a lot to process. But remember, you're not alone in this. Every healthcare provider who's worked in disaster response, they've all dealt with this. And the module, it does a good job of reminding you that there's help, there are resources, systems to help you get through those tough choices.
There's a section I thought was really helpful. It talks about finding mentors, or preceptors who have actual disaster response experience.
That's such good advice. To have someone who's been there, who's actually seen it, they can share what they've learned, how they cope. It makes a world of difference.
Yeah.
It's like having a guide, to help you navigate the wilderness of disaster triage.
And I bet connecting with other nursing students or healthcare professionals, anyone who's into disaster nursing, that can create a real sense of community.
Oh, yeah, for sure.
Knowing you're not alone,
Yeah.
other people are going through the same thing.
Exactly. Having that support network, mentors, peers, is huge.
So as we wrap up this deep dive, let's leave our future nurses with some key takeaways.
Love it.
First, disaster triage. It's not a set it and forget it thing. It's always changing. You have to keep reassessing, be ready to adjust as things unfold.
And don't be afraid to ask for help. Your team, your mentors, your support system, they're there for you. These are some of the toughest calls you'll ever have to make, and it's okay to reach out. Actually, it's essential.
That's a great point to end on. Disaster triage is complicated, it's challenging, but with the right training, the right attitude, and the right support, you, as future nurses, can be amazing in these situations.
And who knows, maybe you'll be the seasoned guide someday, sharing your experience with the next generation. Passing it on.
To all our nursing student listeners, thanks for joining us on this deep dive. Hope it was helpful, maybe even inspiring. Keep learning, keep growing, and keep pushing to be the best you can be, no matter what. Until next time.